secure jobs for the entire region and Newfoundland and Labrador. We all continue working hard to find solutions with our municipal and federal partners. Newfoundland and Labrador, please continue to protect yourselves and each other. Wear a mask, keep your distance, wash your hands. When it's your turn, I encourage you to get the COVID-19 vaccine. It is safe. This is a challenging road we're on. Some of us are more affected than others, but we must all, every single one of us, continue to do what we can for our mental health. Time outside, physical exercise, connecting with other people in your communities, virtually or safely in person. These are all some of the things you can do, and there are resources available to help if you need them. So please, take care of yourselves and each other. We are doing so well with combating the spread of COVID-19. Let's keep it going. I'll now invite Dr. Fitzgerald to share her update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. So we'll start with an update. Since the media advisory yesterday, we have no new cases of COVID-19 in the province. There is one person in hospital. The total number of cases in our province is 393. 383 people have now recovered, and we have 3 active cases. In total, we've tested 75,412 people. Across the country this past week, we saw record-breaking numbers of reported COVID cases. Almost everyone in our province has friends or families living away, and our hearts go out to them, whether they have been directly impacted by the virus or by job loss or by the emotional impact of the lockdowns or even the unrest happening in the US. Here in this province, the measures we have been taking are proving effective. And this has only been possible because everyone is taking self-isolation and travel measures seriously and applying their layers of protection to prevent infection or transmission of COVID-19. These are difficult measures to adhere to, but they are working because of our determination to get through this together. I want to once again express my gratitude to everyone in our province who adhered to the guidelines during the holidays. The past month was a period of great risk. You all stepped up your efforts, and it is paying off. I also want to thank the individuals who could have traveled to the province but chose not to. We have had many individuals write to us to say that they have decided not to travel because of the risk of COVID. I know for each of them that this was a difficult decision, but also a very selfless one. Each sacrifice has played a role in our success. Every day that our province is spared from the virus that has taken hold of the outside world is another day that we can hug our loved ones and move freely about our province, working and doing activities we enjoy, albeit with great care and caution. For public health, each day of reprieve we are granted buys us precious time. Time to get more people vaccinated, time to plan and refine our strategy based on the latest evidence, and time to learn from the lessons of other jurisdictions that have not been as fortunate as us. Each day without COVID is a gift, and we must take every advantage to enjoy it because we know not the hour when our fortune may change. We must also use this time wisely to build our resiliency and prepare for any eventuality. As we continue our COVID vaccination program, I know there are many questions about how we choose priority groups. As I have indicated before, we align with national recommendations. With a limited amount of vaccine currently available to us right now, we must ensure this precious resource is allocated in the most effective way. So we must continue to focus on those who are at most risk for severe complications of COVID-19 and those who are key for maintaining the integrity of our healthcare systems. The evidence is still evolving with regard to how well the vaccine prevents transmission of this virus. And that's why we must continue to adhere to our public health measures until we have the evidence to support lifting them. So travelers who have received the vaccine are still required to abide by the self-isolation requirements in place. We all still need to practice physical distancing. We all need to wear masks in indoor public spaces. We all need to keep our close contacts to as few as possible. And we all need to stay home if we are unwell with COVID-like symptoms. Until we have a sufficient proportion of the population vaccinated, we must remain diligent. We know that there are other viruses circulating, such as those that cause the common cold and gastroenteritis or stomach flu. Unfortunately, these symptoms are often the same as the symptoms of COVID. So you should call 811 if you have one of the following symptoms: fever or new cough. You should also call 811 if you have 2 or more of the following symptoms: shortness of breath or difficulty breathing, runny, stuffy, or congested nose that is not related to other known conditions, sore throat or difficulty swallowing, headache, acute loss of sense of smell or taste, unusual fatigue or lack of energy, new onset of muscle aches, loss of appetite, and vomiting or diarrhea for more than 24 hours. We are starting to head into the time of year when influenza traditionally peaks in Newfoundland and Labrador. And while we have been fortunate to date, I'd still encourage anyone who has not yet received the flu shot to make an appointment to do so. We also recommend downloading the COVID Alert app on your phone. The app can help protect you and others by alerting you if you've had an exposure to COVID-19. For many people, the winter season can be hard at the best of times, with the short days and long dark evenings, and this can take a toll on one's spirit. Take care of yourself. Eat well and remain as active as possible. Take in the fresh air and beauty of the landscapes that we are so privileged to have. The unseasonal lack of snow and milder temperatures in many parts of the province means safer and more pleasant conditions for walking. It is a welcome reprieve in the midst of the pandemic. As a recap for those who may have just joined us, we have no new cases since yesterday's media advisory, and our total number of cases in the province is 393. My hope is that we continue to keep our case count low, but that can only continue if we all persevere. With every day and every person that gets vaccinated, we continue to see the glimmer of hope for more normal times that we are all looking forward to. But we still have a ways to go, so hold fast. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now turn it over to Minister Haggie for comments.
Thank you very much, Premier. Again, 0 is our target, and we've made it. That's congratulations again to the people of this province, particularly who listened and heeded advice over the holiday period. We have 3 active cases. I think that's our lowest number now for some considerable number of weeks. I have a few comments around things we've been discussing on and off over the last few days. Firstly, the data hub, which contains cases and test numbers and these kind of things, as of today, will now include vaccine numbers. It will be broken down by Pfizer or Moderna. It will be broken down by those received and administered, as well as first and second dose. And it will also be further divided in a slightly different way for regional health authorities, so the geographic distribution can be seen. This will be updated on a weekly basis henceforth, usually by 3 p.m. On a Wednesday. Today it should be ready by the time our media availability is over, and in any event by 3 o'clock. The other change we have made is perhaps more behind the scenes, but it relates to the COVID-19 online assessment form. We've now kind of redesignated this as a tool for the public. You can go on there, you can do the self-assessment, and if through the algorithm you are deemed to be an appropriate candidate for consideration of a COVID test, this form will automatically go electronically to the public health officials in your region, and they will then call you about an appointment. It removes that step where you have to get a phone number for public health and then call them yourself. We hope this will streamline things, and for those people who don't need a COVID test, they'll get an instant answer and some advice as to what to do. That too should be live by 3 o'clock this afternoon. As the Premier and Dr. Fitzgerald have mentioned, the vaccine rollout is progressing well. And the plan for subsequent phases and groups even within phase 1 that we haven't yet addressed will be put up on our website, COVID-19 info, as and when it's fleshed out, so that people know what to expect and ideally when to expect it. We have news of an increase in availability of the Pfizer vaccine nationally. The number is 20 million more doses from the federal government. We have a health minister's call later on this week, and I'm hoping that we will be able to get some update on when we could expect our share of that. We get 1.4% of any national deliveries, and that is determined by our population. That equates to, over the course of 20 million doses, 280,000 extra doses, which would be sufficient to completely vaccinate around a third of our eligible population. So we're looking forward to hearing about that. We are working extremely hard, both in the department and across the regional health authorities, to make sure that as we get the vaccine from the federal depot, we deliver the vaccine into people's arms. Central Health have used entirety of their first tray. They've started long-term care, and as have Western today. And Eastern Health will be starting long-term care tomorrow once they've finished off some of their essential worker vaccinations. Talking of vaccinations, our latest flu vaccination figures show that we reached 54% of the population, a slight increase over the Christmas period. It is still time to get your flu vaccine. It is still important for you to get your flu vaccine. And whilst Public Health run an excellent clinic system with appointments you can book online, there are also other providers such as pharmacists and this year family physicians who can provide that service for you as well. So again, to close, I would reiterate that it's important, no matter what vaccine you've had for COVID, that you still adhere to public health measures, and that will be necessary until we can get sufficient of our population vaccinated in the numbers we need. So with that, Premier, I'll hand it back to yourself and the media.
Well, thanks so much, Minister Haggie. We'll now open it up to the media for questions.
Thank you, Premier. For the benefit of our speakers, there are 4 reporters registered for today's call. The question and answer session will be conducted in 2 rounds where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Premier, I want to ask you about Air Canada pulling a number of routes out of this province. In part, Air Canada blames the travel restrictions that provinces like us have put in place. That's obviously impacting demand for travel when we're telling people not to travel. So is the province looking at providing financial support to the airline industry like we've done to other industries in this province that have been hit by provincial measures?
Well, Peter, as you know, air travel often it does fall under federal jurisdiction, and certainly that's why I made the phone call this morning and talked to the 3 federal ministers that this is an important file on the federal Minister of Transportation's desk. He understands the importance of it, not just for Newfoundland and Labrador, but for regions around the country. If you noticed, it's not just Newfoundland and Labrador. There are different regions around the country that have been impacted by Air Canada's announcement. And he understands, as does Minister LeBlanc and Minister O'Regan, the importance of this issue for Newfoundlanders and Labradorians and indeed all Canadians. And I'm confident that they will continue to work with that industry and Air Canada in particular to find a resolution to protect those routes as we emerge from the pandemic, which is most important for industries like tourism for Newfoundland and Labrador.
And this is a question for the Health Minister and the Premier. We saw concerns over Nalcor sending workers from out of province to the Muskrat Falls site after 7 days of isolation rather than a full 14. What isolation do you expect from Nalcor for out of province workers headed to the site?
Minister?
Yeah, certainly. The requirements for out of province essential workers are laid down in special measures orders. My understanding of the issue as it relates to that flight is that in addition, Innu Nation and Nalcor had agreed on extra measures over and above those put in place by Dr. Fitzgerald. And on the occasion of this flight, for some reason, Innu Nation felt that those extra layers were inadequate and asked Nalcor to hold the flight. I can't really speak to it more than that because my understanding is this is a separate arrangement between Innu and Nalcor on top of provincial requirements.
Thank you.
Our next questions are for Kellyanne Roberts with NTV. Please go ahead.
Thank you. With the news that more vaccines could be coming to the province now that the federal government has allocated more, is there talks about potentially trading vaccines? For example, our Pfizer vaccines going to Ontario and us taking more of the Moderna, knowing that with our geography, it might be easier to administer Moderna here?
Those are all conversations that are being had at the national level. I would imagine they're being had at all three of our tables, and that's certainly something that is under consideration when making these decisions. But most importantly, for everyone at this table that we're currently talking at, our primary concern is the health and safety of Newfoundlanders and Labradorians and ensuring that we get the amount of vaccine that's required for all Newfoundlanders and Labradorians in a timely fashion.
Thank you. And when it comes to defining the priority list, the priority 1 list is defined pretty well online, priority 2 not quite yet. With the allocation of more vaccine coming and Labrador having worked through quite a bit of theirs already, how long are we expecting to take to get through priority 1?
So our goal is to be through those in priority 1 by the end of the first quarter of 2021.
Thank you.
Our next questions are for Richard Duggan with VOCM. Please go ahead.
Thank you. VOCM, we recently spoke with a rotational worker who expressed numerous concerns and frustrations to us, one of which was around self-isolation. He says he works at an outbreak site but doesn't understand why he can't do the modified self-isolation for regular rotational workers. He says after almost a year of this, it's taking a toll on families, and many are considering making permanent moves to other provinces, such as Alberta. Just wondering how this has been a topic that's been discussed over the entire course of the pandemic. How do you respond to those concerns now that these rotational workers are now nearing on a year of this?
Well, first, before I turn it over to Dr. Fitzgerald, let me say this, that we're entirely empathetic towards that rotational workers situation and family. We understand the impact that it has to have on a family unit, on an individual and their mental health, and we can appreciate the sacrifice that rotational workers in particular have given to the people of this province. And we really empathize with the position that them and that their families are in as we continue to struggle through this global pandemic, most of which the forces are beyond our control, and we truly appreciate their efforts. In terms of the exact science behind rotational worker testing and what we've done here, which I think we know has worked, I'll turn it over to Dr. Fitzgerald.
Thanks. Yeah, so what we know is that workers who are coming from an outbreak site are at higher risk for having COVID-19. And we have seen, certainly in our own demographics, that in our own epidemiology, I should say, that a significant number of workers who have come back, who have tested positive for COVID-19, have actually been from outbreak sites. So, we feel that, again, trying to balance the well-being of the individuals and the health of the population, that, this is where we find that balance.
Thank you. And Dr. Haggie, I've heard you mention a few times over the last number of briefings and about vaccine wastage. And I know you've said it's a very small percentage, but I'm just curious about what exactly that means. So, for example, what happens for you to consider a vial, let's say, to be wasted or contaminated?
The decision to use a vial is based on the clinician who uses it. Sometimes those vials have a little bit left in them, and for reasons of safety, they feel that they shouldn't use that because it's been out too long, or it may have been contaminated by an incorrect technique. the first round of vaccinations in Eastern Health saw 18 doses lost, which, given the number of vaccines administered that day, I think was something like 0.1% of the doses given. We have noticed through the experiences of Nunatsiavut and the Labrador Grenfell teams that went out to the coast, they've consistently got actually 11 doses out of each Moderna vial, and they're only advertised to produce 10. So what we're losing on one end, we're gaining on the other.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon.
Hi.
There's a very useful national COVID tracker site that's voluntarily run out of Saskatchewan. And the person who runs it says this province has been one of the least transparent that he's dealt with when it comes to vaccination data. He says he was even refused data that was publicly offered to reporters at the time. I realize there's data going up now on what is the reason for this?
I have no knowledge of a request for data from outside, whether that went through public health. It certainly didn't come to my eyes. I would argue that we've been very diligent in providing what information we have in a way that is understandable and easily accessible for folk in the province. So I'm not sure what request we didn't get or denied. Unless public health have some knowledge that I don't, I'm totally unaware of this issue.
And to be fair, I mean, all the numbers that we've been sharing on these every 2-day calls have been the numbers that would be publicly available anyway. So we've been providing all the data that is available to us. There's nothing to hide here, I assure you. We want the public fully informed, educated, so that they can make the right decision and get this vaccine when the time's available.
Okay. And when it comes to prioritization, are community nurses among those in the top priority, the phase 1 priority? How high up are they? Are vaccinations started for them, community health nurses?
You mean the community health nurses giving the COVID-19 vaccines?
No, just community health nurses who may, for example, have to go out to people's homes and that sort of thing.
So certainly our healthcare priorities in this first priority group are those who are caring for people who are most at risk, certainly in long-term care and personal care homes, those who are involved in the COVID-19 response in acute care, so that includes people in ICU and COVID units and emergency departments, and then those who are involved in the COVID response by doing assessments or testing, and then those giving vaccines to make sure that, obviously we need to make sure that our vaccinators are able to continue to do that. So for some, these are regional, the regions will decide who fits in that category in their regions. So I can't comment as to whether specific nurses will actually be those receiving it, but we certainly have faith in the regional decisions there.
Okay, thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Just following up on the issue of rotational workers, they've raised concerns about the fact that Alberta is no longer tracing back the origin of any new cases. So if a worker works on a job site, but even if they catch COVID somewhere else, they're still attributed to that job site, leading to an increase in the number and leaving more sites on the outbreak list. How concerned are you about that lack of information that Alberta is gathering? And doesn't it make that unfair then to continue to require isolation when in fact the job sites may not be the risk areas for some of those workers?
So I think that Alberta is making those decisions based on some, it's not just a haphazard decision. They're basing that on evidence and information. And so we certainly trust to their ability to do that. I mean, we know that Alberta is working very hard right now to respond to the COVID pandemic in their province, but we certainly have faith in the ability and expertise of public health in their province.
But Peter, that's a great example of where two different jurisdictions with two different epidemiological patterns drive two different decisions.
And Dr. Fitzgerald, I want to ask about face shields, because there seems to be a bit of confusion. We saw earlier this week you saying they're not a substitute for masks, yet in a lot of restaurants we're seeing servers wearing them, and a statement from your office says that's okay. So can you provide some clarity here? Are face shields an acceptable alternative to face masks?
Face shields are recommended for people who may not be able to wear a mask as an alternative, as a way to reduce risk somewhat. However, face shields, as you know, if you're talking about the kind that you wear that are suspended from the top of your head that come down over your face, obviously there's a lot of open area down here, so droplets can fall out. So no, they're not as effective as a mask at reducing droplet spread. The plastic face shields that you see that come from the chin and go up over the nose are open up at the top. So no, the droplets can spread out that way. So once again, they're not as effective as a mask, which would come tight over the nose and underneath the chin.
Thanks.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Wondering about those who do get vaccinated, not just from this province, but nation and globally. If they are vaccinated and they arrive in the province, do they still have to adhere to the self-isolation order? I obviously know that that's part of the public health guidelines, but just wondering in terms of with the vaccine.
Yes.
So to reiterate Dr. Fitzgerald's earlier point, the science is still unclear whether a vaccine will prevent transmission of the disease. So the current recommendations are yes. That's fair?
Yep. Yep.
And when it comes to gathering sizes, we know that the 20 for 2020 is being carried for a little while longer. Are we also looking at reevaluating in terms of organizations, examples for weddings and things like that in terms of gathering sizes?
So at this point, the gathering sizes are remaining where they are. Given our epidemiology, we feel it's still safe to do that. Our biggest concern are those informal gatherings that happen where, there's not, it's not being organized by a recognized business organization. So that seems to be a big driver in other areas of the country, and so we do have concerns in that regard. So at the moment, things will be staying as they are.
Thank you.
Our next questions are from Richard Duggan with BOCM. Please go ahead.
The initial shutdown back last March forced the shutdown of a lot of medical services for some time, which created backlogs. And then when we started reopening, we were working through those backlogs. I'm just wondering, where are we now in terms of backlogs within the healthcare system?
As far as the information that the regional health authorities have provided, those people who were identified to the RHA as waiting back in the beginning of phase one or the first wave, those have been dealt with. The challenge we have is that information really only pertains to about a 2-week list of operative procedures particularly. So we don't know what is still held in private physicians' offices in terms of wait lists. Certainly the responsibility for prioritizing cases is that of the surgeon, the physician, the person doing the procedure. We have activity reports from the regional health authority up to just before Christmas that showed that most services were within the band of 98 to 105% of their activity compared with the same time the previous year. There is normally a pause over Christmas, traditionally, in elective procedures, simply because people choose not to come in over that period or haven't in the past. So I don't have any up-to-date data since the normal working resumed on the 4th.
Thank you. And of course, mental health of medical staff has been top of mind during the pandemic, and we've seen some of the devastating effects for those, especially in the hardest hit areas. I recall a heartbreaking story out of Quebec recently. What are we hearing in terms of mental health of staff here lately?
Of staff? I think they are reflective of the population with an overlay of the stresses of having to provide care for individuals who may have COVID-19 and under different circumstances. For mental health generally, we saw a significant uptick in a lot of services around the period of April to May. That rate of increase has dropped off. And despite increase in access to doorways and e-mental health services, we're actually seeing a continued gradual reduction in wait time for counselling across the province.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hello. It seems, anecdotally at least, that some people were caught off guard by the antibody home testing kits that are being distributed by the COVID Immunity Task Force. When was the Department of Health made aware of them, if at all? And was there a request to give the public a heads up?
That was a federal initiative. We were aware it was going to happen. I don't recall us getting an awful lot more notice than, the rollout will be this week kind of thing. The advertising and the promotion of that was all done through Health Canada and I think their research arms.
Okay. And just what would? Sorry, was someone else trying to? No.
No, go ahead, Peter.
Sorry. Okay. In what ways would the results of that testing affect public health policy in this province? Would it make any difference, or would there be any information you think it might provide?
So I think that the goal of this it's a seroprevalence study, so it's just looking to see if people have antibodies to the virus, and at this point, I don't think it would change a whole lot of what we're doing. We wouldn't anticipate that there would be a lot of people who would have antibodies, just given our numbers, but it would certainly be interesting to know. It would give us some idea as to, is there more spread beyond what we know about it? Would people have asymptomatic disease, those sorts of things? But I don't know that it would change much in our policy at this point with what we expect to see from it. But we'd have to see what the results would be.
Okay, thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
A question about uptake of the vaccine. We saw in Black Tickle we had excellent uptake with 69 out of 70 people there. Within healthcare workers, what are the numbers in terms of, do we know how many have declined to get the vaccine? And what the impact is if a nurse or a doctor says they don't want to get it?
We don't have any data on people declining in this first round. I think the proportion of people who were interested in getting the vaccine in relation to the doses available in the categories we were looking at was such that we had very little difficulty in administering pretty well every dose that was scheduled. I know there were some people who were given vaccine who were kind of vaccines of opportunity. A couple of people didn't show up. They had 3 doses left in a syringe, and they grabbed the next 3 people they could find to avoid wastage. In terms of formally documenting hesitancy or refusal, I'll certainly go back and see if we have any data, but I suspect even now it might be early days yet.
Anecdotally, Peter, I mean, all the doctors and nurses I know are anxious and ready and waiting and hungry to get the vaccine, not the other way around. Although I have heard some stories of some people having hesitancy, and that's normal to have some anxiety surrounding a new vaccine or a new piece of technology or anything that's new, frankly. But once again, we reassure everybody that these vaccines wouldn't have been approved by Health Canada without a robust scientific process, one that's has some of the, probably the highest rigor out of any country in the world. So the general public can rest assured that these are safe vaccines.
Our next questions are from Kellyanne Roberts with NTV. Do you have a final question, Kellyanne?
I do. For the briefing on Friday, will all three of you be in attendance?
That's the plan right now.
I will be here, but I will be virtually here, all being well.
Thank you.
Richard Duggan with BOCM. Do you have a final question?
Nope, that's it for me. Thank you.
Thanks, Richard. Peter Jackson with the Telegram. Do you have a final question?
Just one. You talk about how you're working on prioritizing groups and other categories. We get a lot of questions about whether teachers, vocational workers, people in the service industry. When you finally come to these decisions, will there be a fairly firm list of priorities that people can follow and expect to know when they'll be on the list?
Yeah, so at the moment we're in the process of developing those priorities, we'll it very much depends on how much vaccine we get in the second quarter and throughout the second quarter. So I think we need to consider that. We know that age is our biggest risk factor for severe disease and severe outcomes from COVID-19. So we will be steadily working through the older age groups to make sure that we get those people vaccinated. We will have plans in place. If our supply is not abundant, then we will have certainly well defined groups in place for receiving the vaccine.
Okay.
And Peter, all of that will be done in a very open and transparent way so that people will have a full understanding of where they are in the line, and it'll be very open. There's nothing to hide. Once the decisions are made, everyone will be aware.
Okay, thank you.
Thank you, everyone. Premier, do you have any final comments today?
Well, thanks for joining us today. Again, another great day with no new cases, and we're down to 3 active cases in the province today. That's something that we should all celebrate. That's largely because of all of you at home, following the advice, following the public health guidelines, and we are able to enjoy some freedoms and being able to hug loved ones, as Dr. Fitzgerald suggested, that simply others across the country that we know, family members, friends, are not able to do. So please, please use that as motivation to keep up following the public health guidelines and look after yourselves and each other. And if you need help, please reach out.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive